Okay, good afternoon, wherever you're watching us from. My name is Mr. Selfcare, your host tonight, and today we are going to have a very wonderful discussion, a very wonderful conversation about young people and their role in combating HIV infections today. A lot of stories have been going around this week, ranging from a young man that was killed when they had gone to visit a girlfriend somewhere in Mwakiso or Nansana. And that actually clearly shows us that young people are actively or sexually or are involved in relationships. If you look at the data for last year, the number of young people continuing to have new infection is going up. That means that we need to talk to them, or we need to equip them with skills or with information about actually combating HIV infection. Tonight in our studio, we are joined by a very knowledgeable young person that has traveled the world, teaching or preaching or talking about the message of HIV in young people. And we believe that is going to be very important to this channel, but also speaking in the lives of young people. This program is happening every Wednesday at 9:30 with the support or partnership of AHF Uganda Cares that make sure we get all the right, relevant, and recent information when it comes to HIV, AIDS, prevention, testing, but also other sexually reproductive diseases or infection. I want to welcome you to this show and to remind you that if you're here for the very first time, remember to tune in every Wednesday 9:30 to be part of the conversation, but also to subscribe, comment, and always leave your question in the comment section. And our hosts or guests will always make sure that your questions are responded to. Mr. Trevor, you're welcome to our studio, and thank you so much for making it here.
Greetings, Mr. Selfcare. I am very delighted to be a part of this very interesting discussion today and looking forward to unpacking a lot and having a very rich, deep, and meaningful conversation when it comes to young people. I'm always passionate when we're having these discussions. It's a rewarding experience, and I look forward to a very meaningful discussion. Thank you.
Mr. Trevor, to so many that don't know you, who is Trevor and what do you do at AHF Uganda Cares?
Thank you. So yes, Trevor Emojel is the youth coordinator, AHF Uganda Cares, where I have the awesome privilege of working with young people. I can tell you that it's a testing experience. You get to understand that young people are not homogeneous in nature, but that their needs are stretched and various. And so you need to be someone who is flexible, approachable, and open to learning, because there's a lot. But for me, like I said, it's a rewarding experience, and I think I'm looking forward to unpacking a lot of that in today's discussion. AHF is an HIV/AIDS organization, and we shall be unpacking a lot of that in our today's dialogue. But thank you for having me, Mr. Selfcare.
You're welcome. Let's start there. When I put up this topic about young people, the biggest question that so many people have been actually asking in the comment section, even before we came, is the definition of a young person. Trevor, who is a young person at AHF Uganda Cares?
So the discussion around who a young person is globally contested, but I will say that in regards to health, specifically, I will say that when you look at adolescents are young people between 10 to 19 years. We like to break it down further into looking at the younger adolescents, that's 10 to 14, and the older adolescents, that is 15 to 19. And then for purposes of a priority population, or when we are trying to assess risk, we like to categorize young people as people between 15 to 24 years. Yes, it is a priority group. As you could see, many bodies use that when they are quoting data, when they are quoting HIV risk. You'll see World Health Organization, UNAIDS, and different institutions quoting 15 to 24 years. Why we use that? We know that the one below 30 is still a young person, 29, 28. However, the priority group that we like to look at is between 15 to 24, but we still know that they're all young people. However, for our services, we like to look at from 10 to 24 years old.
Okay, I think our audience right there can clearly get who we are referring to when we talk to when we say a young person. Trevor, tell us about um, your role and what you do every day at Uganda Cares as a youth coordinator.
So, yes, AHF Uganda Cares is known for its cutting edge medicine, regardless of the ability to pay. AHF has its programs that fall under HIV care and treatment. That is where we give this very high quality but affordable medication for people living with HIV. We also have prevention, where we are letting people know that HIV is still here. And because we've collapsed on the use of prevention methods, we are in a way letting HIV win. But in our strategy, we are ensuring that that is where we talk about condom use. That's when we talk about behavioral approaches to prevention. And that is where we are ensuring that we reduce young people's vulnerability to HIV and AIDS. And then lastly is where we have advocacy. Advocacy is where we are representing people who are priority populations or people who are not able to speak for themselves, but ensuring that we advocate for better access to quality health care, better access to better livelihoods for people, and ensuring that we address structural barriers to HIV, because there are those individual barriers, but there are also structural ones, the government, policies, institutions, etc. So that is where advocacy is very relevant.
Wow, that is so rich, and that is so important, and we are privileged as a country to have actually Uganda Cares amongst us to be giving all that. Trevor, why are young people considered important today to be at the front line in the fight against HIV? Why are we eventually now want to put them at the front line, and why are we involving them more than actually we've done before?
That is a very important question. And to break it down further, when we look at the data, the statistics, I will come specifically to sub Saharan Africa, where the data informs us that we see 63% of the HIV infections to be among adolescent girls and young women, or women and girls. And then when you come down even further to Uganda, you will still see that over two-thirds, when you look at young people who have been infected by HIV, you will see that two-thirds of these are adolescent girls and young women. So why are young people very important? Young people are still very vulnerable to risk, and for a number of factors that have been written about or discussed. But keenly, I will let you know that much as we expect, because over 4 decades of having HIV plaguing the globe, you would expect that people know about HIV to the fullest. But I can tell you that on ground, you will see that you just see that people have scraps of information regarding HIV, and people do not have this comprehensive knowledge. And it gets worse when you look at young people, because the little scraps of information that they have is diluted even further by content that they find online. So you'll find that young people have this information, but because anyone has access to blogging, anyone with a laptop that has access to internet is posting anything online, you will find that now for us who are giving accurate information, we are battling or competing with a lot of misinformation online, which always tends to look attractive. When someone is trying to mislead, their message often looks attractive, compelling. And so for us who are giving the right information, we have an uphill task to ensure that we educate young people. That's why more people have to listen to Mr.Selfcare, because a lot of information that is here is very important. Yes, maybe even further, poverty is also a very serious concern. I can tell you that in Uganda, the unemployment rate among young people is higher than the national average. Young people is about 16%, the national average is around 12%. So you see that puts young people in a state where they are looking for resources and money. And that's when you see adolescent girls and young women engaging in things like transactional sex, because they are seeking survival. And in that long run, you lose track of the prevention methods and end up getting infected.
Wow. Again, I'm glad you've mentioned the issue of fake information out there, where you sometimes you open these social media pages and you start asking yourself if actually you're real. Like you hear someone talk about a subject matter, and you start asking yourself if actually the information you someone is giving up is right or wrong, or something like that. But again, it reminds me of why so many people were asking me last year to talk about HIV, and I kept telling them I'm not well informed when it comes to this subject matter. And actually, that's why I had to reach out to AHF Uganda Care to make sure they give us the right information. So information is one, but picking the right information for young people is very key. Um, Mr. Trevor, working with the young people and traveling the world talking about actually this subject matter, can you give us an overview of the trends of the numbers that can try to paint a good picture to a parent, to a guardian, or to a young person listening in, of why we think actually this is a burden right now? And let us especially zero down on sub-Saharan Africa or Uganda. How bad is it when it comes to an infection about with young people?
Okay, thank you. So my just to look at stat, because you see data is very important and it is always key and critical to quote these statistics. So when you look at adolescent girls and young women, the data tells us that globally 4,000 adolescent girls and young women contract HIV on a weekly basis. That means every week 4,000 adolescent girls and young women are getting infected. So what I'm saying is
Wow.
we are beginning next week on Sunday. By the end of Saturday, we'll see over 4,000 girls who started the week negative are ending the week newly infected. So that is the magnitude of the risk. When you look at it globally, the data is telling us that 1.3 million people get infected with HIV on a on an annual basis globally. So while we have this mindset that HIV is no longer a thing, it is relegated to the past, we are telling people that HIV is still here. And because we've collapsed on prevention news, we've taken a backseat on things like ABC, that is abstinence, behavior, being faithful, and then condom use. Because we've relaxed, we've given HIV the upper hand and they are winning. Much as we see that comparatively, the data from the late 90s, we've seen that we've reduced HIV infections by 70%. That is a good thing. However, we have targets of ending AIDS by 2030, and we are still not yet there. So it means that we need to double up our efforts when it comes to HIV, and that means individual responsibility, holding government systems accountable, and ensuring that we work together towards ending AIDS. And when you come to young people, the risk is very serious because young people are at the center of vulnerability. And for me, the context is adolescent girls and young women. Later, I'll be talking about the initiatives that AHF have that are informed by this data of how adolescent girls and young women are vulnerable to risk, and how we are able to address that as AHF. Thank you.
Yes, Trevor, you said later we'll be looking at how AHF is actually handling that, but I don't want to keep it for later. How is AHF Uganda Cares empowering young people, the youth, to lead the prevention effort? And how is actually AHF tackling this problem?
Yes, so because the data is very evident in regards to how young people are vulnerable to risk, AHF, in its intentionality and keeping its promise on ending AIDS among young people, has two very important programs. One is an entirely girl-led program that is designed to reduce vulnerability of adolescent girls and young women to HIV, and it's known as the Girls Act program. Or yeah, it's a program that was founded in 2016, but over the years has been in place to ensure that, one, we prioritize testing among adolescent girls and young women or access to services. Two, we prioritize economic empowerment, because we've realized economic marginalization of adolescent girls and young women is another serious thing. Poverty, lack of economic or financial empowerment, and that is another arm that AHF is bringing in. Then we also see menstrual health or menstrual hygiene as a critical thing. I think many times we like to relegate this conversation, but menstrual health is a very big player. How do we guide adolescent girls? How do we provide them with the necessary necessities like the sanitary towels, like the knowledge on how to go through that process? And then we also have the arm of education, knowing that when you educate a young girl, you increase her chances of success and higher income, being an empowered person in the future, among others. When we come to the program of we have another program known as the Young People's Program. Now, this encompasses both the adolescent girl and young women and the adolescent boy. Data is also telling us that much as we are not seeing huge infections coming in from adolescent boys, we are seeing that these boys are not taking their medications. Those who are already positive, for example, we are seeing that even when you look at AIDS-related deaths, a lot of young men are actually passing on. Why? When they are positive, one, they don't like to seek services. So we are seeing a poor health seeking behavior among adolescent boys and young men. We are seeing that when they are positive, they don't like to come for appointments in the hospitals. They are not very willing to come and do checkups. They are not very willing to take their medication. So when you put all these in context, we are seeing that even boys are very critical. And that is why we have programs that are tailored towards speaking to these boys, having intergenerational conversations. We have Mr. Selfcare coming to meet young men, or we have role models coming to meet young men. We also have outreaches in schools. All these initiatives are driven towards how are we able to find adolescent boys where they are? Can we go to football grounds? Can we go to gaming centers? Can we go where they are essentially, so that we are able to administer a service where these boys are? So that is the nature of our programs when it comes to young people. At the end of the day, the goal is to ensure that we are ending AIDS among these young people. Thank you.
Wow. Wow. That is so rich and powerful. And for some of these already implemented program, can you share some of the success that some of the successive story that you've experienced as a youth coordinator?
Yes, so the successes are numerous, and I would like to appreciate AHF again for its intentionality and keeping the promise on young people. So we see that, one, we've experienced increased service uptake among young people. There is a magic in going where they are, and that is essentially how our programs are designed now. We go to the community. So in the Girls Act, we have chapters in the communities next to their doorsteps where we can be able to mobilize these girls. So we are seeing where we are seeing increased information uptake. We are seeing that now the girls in that community have more information on HIV. We are seeing that even the boys have more information on HIV where they are. So we are seeing increased service uptake, but we are also seeing more information. When it comes to empowerment, we've been able to skill some young people. So we are seeing that some of them are taking up these businesses. We are seeing some young people becoming entrepreneurs, and that is a plus. The whole goal is to ensure that you emancipate these young people economically so that they can be able to have that living, and then with that living, they are able to, they are not going to be vulnerable to, let's say, sugar daddy who is coming to give them money, or whoever is trying to buy them off for sex or something. So essentially, those are the successes we've registered. We've also retained many girls in school through our education. We've seen some of them go to law school now, some of them are going to medical school. These are young people whose dreams felt like they were not going to happen, but because of the contribution of AHF, and AHF is not doing everything. We are working as a collaborating partner. We're working with parents as a stakeholder, for example. We are working with the schools. So having that partnership is also helping us empower even communities to see the importance of some of these things. Because while we are coming to pay some tuition, we're also telling these parents the importance of education in their children. So when you look at all that, you will see that in a nutshell, comprehensively, AHF is making impact in young people, but through a partnership and collaboration with community. Thank you.
Wow, that is so good. Again, to someone watching in right now, I want to ask you to leave your question in the comment section. Forgive my voice; it's a little coarse. I'm really trying to make it better. Some kind of cough and flu. But I want you to thank Trevor for your time with this. I think you're very elaborative, and I think actually you're giving us a lot of gist on what actually AHF Uganda Care is doing. Again, like I've said before, AHF Uganda Care has been there for so many years, but unfortunately, so many young people didn't know actually it existed. Existed. But we are glad to have Trevor and more people that come out every Wednesday at 9:30 to give us more information about what we do. And we promise all our viewers that AHF, the partnership between Mr. Selfcare Initiative and AHF is going to go on for as long as there are projects or as long as infections are still high there. Our goal is to make sure we impact social media with the right information, properly packed to meet the right groups of people. I have so many of you ask me so many topics of discussion. I promise you every single Wednesday, be here and make sure you're watching. We are going to tackle different things. Trevor, you talked about social media. How can today we see that almost everyone, research is showing us that in every 1 hour, we all look at our phones almost 5 times. Now, that's a lot of times. How can social media be used effectively to raise awareness and mobilize the youth in prevention of against HIV globally?
I am losing you.
Can you hear me now?
Yes, I can hear you now.
Okay. I was asking, how can we use social media to our advantage in the prevention of prevention or combating HIV infections today?
I think that's a very important approach to use now, and I want to believe that it's a timely approach and strategy, especially when it comes to young people. I want the audience to know that there is no one who understands social media now better than young people. And so, if you really want to have messages ripple through and touch young people, it is important that you use the digital environment to touch these young people. So, I'll just give examples. I think for me, the important time when we saw the rise of technology in reaching masses was during COVID, the time where there was social distancing, no one was accepted to move from one place to the other. We saw social media take its course and impact numbers, reaching masses. And I think even for AHF, that was a time we had a campaign known as the Tonzolea campaign. It was an anti-stigma campaign that was able to spread the message on one, positive attitudes towards people living with HIV, two, increased testing, three, ensuring that we tackle stigma and discrimination. And we saw this campaign reach so many people, you know. So what are we saying about social media? Very importantly, is that one, we need to be intentional about the messaging that we are putting out there, but also the packaging of this information. Young people are not used to a lot of text, a lot of writing. Young people prefer the visual communication strategy. So are we using pictures? Are we using music? Are we using short videos that are appealing and visually appetizing for young people? And are we keeping the messaging short as well to ensure that these messages are taken on? Yes. And then for young people, I think for me, my message is not everything on the internet is true or is believable. So I would like to encourage fellow young people watching this to stick to official pages, stick to trusted sources of information. So, for example, you're in the internet and you're Googling something about HIV, can you stick to the official pages, maybe Uganda AIDS Commission, Ministry of Health, etc.? Not every blogger out there is the right information. Watch Mr. Selfcare. He has very good data and very good information on health in comprehensive. So, can we stick to official sources of information? And then, yes, you know how to trust the doctors, trust people who you feel are really critical, but let us not also neglect the physical health workers, because again, it is very important. There is a growing concern, Mr. Selfcare, before we change the topic, of young people using AI as their personal doctors, their personal consultants. I would like to discourage that to a certain extent. Of course, you
Yeah.
can have discussions with AI, but AI is not going to give you a diagnosis. And if you make a decision out of a discussion you've had with a bot, then you are likely to make a wrong decision or a dangerous one. So it is important to double check whatever information you've gotten with health workers to ensure that it is right and accurate. Thank you.
Actually, you've talked about AI. In America, there has been so many medical cases where patients actually go to the doctor's room and start disputing their information based on AI until they start asking them who the author of the AI information is. Then they cannot. So again, Mr. Trevor has confirmed, Mr. Selfcare page Jew, young people, this is your page. Yeah, Mr. Selfcare page Jew. Trevor, you talked about the different programs that AHF Uganda Cares currently offer. Now, let us look at the services specifically. We've had so many people, like three previous speakers, come here and tell us about the different services that AHF in general offers to the public. Now, let's break it to the young people. What services do you give them? Condoms? Do you offer testing? Take us through, in summary, or the services that young people can actually expect to get when they come to Uganda Cares.
So I will not differ from what the previous speakers have been mentioning, but maybe just to add and say that AHF services are entirely youth friendly.
Okay.
Regardless of the site that you're going to go to, AHF youth services have been designed. I mean, AHF services have been designed to be youth friendly to the latter. So
Mm,
wherever you're going to go, wherever you are, I want to give you the assurance that you're going to have services that are not discriminative, that are
mm,
not stigmatizing, and
mm,
that are very suitable to your needs. So maybe what services are there for young people?
mm.
Definitely, we have HIV testing that is confidential, that is safe for you. You walk
Mm.
in, you don't expect to find your grandmother, or sometimes it is the fear. I won't find my
Yes,
uncle or the sugar, but no,
yes.
your services are very confidential and very non-discriminative, and also you get your results instantly. But we
Mm,
also, for those who are living with HIV, definitely we give the quality medication, like we said, the quality affordable medicine,
mm,
regardless of the ability to pay. It's free of charge.
mm,
And recently, we've also started with STI treatment as well. A very important to visit our wellness centers. I think you can see them on the screens. We
mm.
have Chitante Wellness Center, Kalungu, and it is growing as the discussion keeps going. AHF is intentional to expand access and ensure that access is wider than it is right now, because we are seeing, again, informed by data, we are seeing a lot of STI incidences coming up. So all these services are very confidential and free youth friendly. And then we have condom distribution. We are giving these condoms in because we are seeing that the risk is still there. Just to mention, we had condom day not so long ago, and we're in Fort Portal City, where we are seeing a very high prevalence of HIV. But I would tell you that our condom distribution was working so well. We're seeing young people take up these condoms. We're seeing brothels invite these things. And for us, our message is not spreading immorality, but spreading the message of prevention and ensuring that whoever is sexually active is able to have something that is protecting them, so that you don't have unprotected sex, but you have safe and protected sex. Maybe about the condom, it provides the triple protection that we keep pushing for. One, it protects you against HIV. Two, it protects you against STIs. And three, it protects you against unplanned pregnancies. And it is affordable and it's accessible. So these are very important services that AHF is pushing for the populace. Thank you.
Wow, that is very, very, very important. Actually, you've talked about youth-friendly services. Now, that is very important when we talk about youth-friendly services. For people that actually have gone to some of these government facilities, you will understand, or you will agree with me that. that actually, Trevor, there is a time I walked into one government facility and for just research, and they showed me where the art clinic was. So I asked them, is that where I'm supposed to test from? They were like, yeah. Now you find one old chair, your grandmother is there, your aunt is there, your
Mm,
uncle is there. Now you're supposed to sit. Now, the moment you sit, the first question is, hey, what are your senior six vacations, like, I mean, student doing here? They
mm.
either think you've come to pick medication or to check. And that alone sent away so many young people. Now, I'm glad that AHF actually addressed that. For people that have not been to AHF clinics, I'm telling you, it's like you're moving into your personal public office. No one is going to know even you went there. So I think that setup alone and that youth-friendly, you being mindful of privacy, confidentiality, is very important when it comes to young people, and I'm glad to partner with an organization that puts the young people at the center of their planning and doing so many things. Trevor, how do you recruit these young people that eventually benefit from your programs?
So our strategy is informed by need. Okay. So again, the data is very important because we like evidence-based planning and implementation of programs. So, for example, we are now in national data is telling us that the prevalence of HIV is highest in Fort Portal currently at around 17%. So our interventions are informed by such data. So you'll see that we had World AIDS Day there. We've already established youth groups there. We would see them very active in the Condom Day, World AIDS Day. They are now the ones who are the peer educators, ensuring that we transform young people's mindsets on HIV, sending this information around. So we are seeing that wherever there is need, we're also seeing sorority, and I am glad to say that AHF is in some of these very critical areas where we are seeing need. We're in Fort Portal, we're in Soroti, we are in Jinja, we are in Gira, all these places where we are seeing that the prevalence is high. So our presence there is not just for passing time, but to ensure that we leave impact and legacy of improved in the improved state of. So if we enter there and the HIV infections were high, especially among young people, at the end of the day, we need to see more service uptake. That means more young people testing, more young people using condoms, more young people, if those who are not on treatment, accessing treatment, among others. So yes, for the girls, we usually reach out to high risk communities and ensure, for example, here we have Katanga, where you'll see that we have chapters in the communities, and then we have chapters in the communities, and then we have peer educators, female young peer educators who are always giving information on a weekly basis and having chapter meetings and ensuring that this information is spreading and the right information is reaching adolescent girls and young women. You see us talking to the parents, you see us having meetings with community leaders, because we believe it is beyond just an individual, but also the community has a very big role to play. In the old tradition, they used to say it takes a community to raise a child, and I think we still believe in that notion and that concept. So you see that we're empowering everyone in the community beyond just the young people. We are talking to the parents, we're talking to the leaders, we're also talking to the border riders because we know that some of them are the ones who are with the quick money they are making. They are preying on these young girls. So it is concerted effort. AHF loves to embrace partnership because we believe that we deliver using partnership, and essentially that is our approach to work and ending AIDS among young people, but the general population.
Some questions have started coming in, and we shall be answering them along the way. Again, if you're a young person watching in, please feel free to leave your question in the comment section, such that Trevor will answer it before the end of the day. Trevor, how does your role, how does the youth service alone play or add to the big vision of AHF as an organization?
So the young people's efforts and strategies fall strategically under AHF's mission because um, AHF is entirely its effort is focused on delivering, cutting edge medicine regardless of the ability to pay, and advocacy as well. And we see that we position young people on every strategic area of AHF. And I am glad that AHF has a young youth coordinator who is myself, but also a remarkable team who are not part of this conversation, who are really supporting this work to happen. The prevention team is extremely passionate. The advocacy team is always on their toes. And I'm glad that it is all that has helped have this conversation come to life. So young people are at the heart of AHF's work because at the end of the day, it is the next generation. They are the future generation. So AHF supporting, empowering, and ensuring that young people's needs are met is a strategic move to preserve the future and ensure that we have empowered and ready young people to take up future responsibilities.
Trevor, I love stories as a person coming up from Uganda. I love stories. Trevor, I know in that each time I've interacted with young people, there are remarkable stories that always stay on my head or something like that. Trevor, what are some of the life stories you've had from the Youth Corner that you can share with us today that you think actually have inspired you, or you think that have motivated you to even spend sleepless nights talking about HIV prevention in young people, or that actually motivate you to keep going every day? You could tell us one from any part of the world where you've had it.
Well, there are many, there are extremely many, but it is always a rewarding experience to see a young person get empowered. There was a time way back, we AHF at the time organized young people and took them to parliament. It was a discussion where young people were mobilized to have discussions with members of parliament. And then one of the attendees then said, without AHF, she would not have had the opportunity to walk into the parliament and have discussions with high level stakeholders of that stature and nature. Today, she's a very empowered girl who is leading in spaces. We've seen her transformatively change. A person who has been having issues, having psychosocial issues, but being empowered entirely to be the kind of person she is right now. So, right now, she's in medical school. She's almost completing, but that is just one of the many stories. There are so many examples of empowerment that AHF has, but I think for me that was very touching to see her right now very empowered and leading, and yet then she was a raw young person that AHF, empowered, and she's now there. For me, is a very rewarding experience, and many others that we could speak beyond this conversation. Thank you.
Trevor, as we wind up this section, what are some of the barriers that you think have been affecting young people in accessing the services they're supposed to when it comes to HIV prevention?
So barriers is a very important question because we still see a lot of barriers still to date. And maybe one of the barriers is stigma and discrimination. I want to categorically say that stigma and discrimination is still a pressing challenge globally, nationally, in our communities. Uganda has anti stigma and discrimination guidelines, but we can still see, despite those laws, we are seeing gross violations of young people's rights. I'll just give an example. Right now, I think under police there was a directive to ensure that prisoners are tested. People are getting to prison are all mandatorily tested before they get into the cells. And I think that is one of the things we are trying to contest because it goes against the confidentiality of testing. It goes against and violates many policies that we have in place. So stigma and discrimination is definitely one of the very serious concerns. Because even when you look at prisoners, over 58% of our prisoners in Uganda are young people or fall under the youth age. So for me, it's a pressing issue because they're all young people. Most of them, in a big number, are young people. Then, of course, we still have things like lack of awareness, lack of information. Like I said, there is a big expectation that everyone knows about HIV after overly 4 decades of HIV, but I can let you know that we still have a lot of work to do when it comes to information. The UDHS tells us that averagely 50% of people in Uganda have comprehensive information about HIV, just 50%. So you
Wow.
can see where the other 50% are. You can imagine.
Mm,
This is national data, national
mm,
reports. So, yes, we're also seeing lack of capacity for young people to
mm,
engage in these spaces. We need
mm,
young people who are informed about policies because at the end of the day, this
mm,
information is what you use to advocate, what you use to criticize something that is not working. It is where you understand the workings of a system and the government. But
mm,
if you do not have this information, if the only thing we are showing you is entertainment and you are not keeping up to terms with policies and acts and how systems are working, you will find that most rooms are excluding young people because they will say, they are not yet fit to engage in these critical discussions. But what we are doing is we are empowering young people to be able to sit in those rooms and speak to seats of power and
mm.
ensure that they're also able to make very valuable contributions in terms of policy making, leadership, and others. Yes.
Trevor, that's a very good point of empowering young people to speak to those in power. But are those in power anyway willing to listen? Anyway, that will be a discussion of another day. Shifting the page to prevention now, Trevor. Uh, sh- Yes, again, if you've just joined us, we're having a very good conversation with Trevor. Trevor heads is the youth coordinator at AHF Uganda Cares, very knowledgeable, traveled guy, very well informed about the subject matter. And I believe if you're there, if you're an organization that needs someone to speak to your young children, to the young ones about HIV, I tell you, Trevor is the guy to go for. Trevor, let's talk about prevention. Last week, we had the head of prevention, HIV prevention at AHF Africa Bureau, and he gave us a lot of insight. In a nutshell or summary, what does combination HIV prevention mean to young people, and why is it now important that the young people do not stick to one method of prevention, but rather methods of prevention that are available to them, especially at AHF Uganda Cares?
Pardon, I think I'm losing you.
Oh, sorry. Um, Again, I was saying that let's talk about prevention. Why is it more
Mm.
important that today we encourage young people to use more than one method of HIV prevention rather than sticking to one method like it's been before? Following the
Yes.
discussion we had last week with the head of prevention of HIV in AHF on African Bureau.
Yes, thank you. I will basically add to that conversation
Mm,
by saying that or beyond when you look at the 4 decades plus that have gone, on HIV,
mm,
I think what is critical also is that we've experienced scientific advancements when it comes to
mm,
giving options for
mm,
young people when it comes to prevention. And what that
mm,
means is that we are eliminating excuses.
mm,
We are eliminating excuses when it comes to, this doesn't work for me, but I need this. That is why you're seeing we have prep, we have the condom use, we have the
mm,
dapivirine ring. Now we have injectable prep,
mm,
that is coming in. So all these different options that are coming in are increasing your accessibility to make an informed choice on what works for you best,
mm,
or what is ideal for you. And that is why we are giving you this entire package so that you understand the varieties of prevention, options that we have.
mm.
So we are giving you all these alternatives. I just want to connect it to power as I'm losing power. We are giving you all these alternatives to
Yeah.
ensure that you have access to different methods.
Okay. Trevor is trying to connect his gadget to power. to make sure we continue this conversation. This is a very good conversation that I wish everyone on social media would be having. To my friends that are running different social media accounts, please take time to invite people like Trevor to have this discussion. Our young people are dying. Our young people are suffering with sexual behavior or things around sexuality. This week alone, we had a young man who was beaten because the father of a girl found him in his house. And maybe the parents actually didn't know. So dear parents, the more we keep quiet about this conversation about HIV/AIDS, about sexuality, the more we are going to see our young people actually suffer from things that we can prevent. Yes, Trevor. Let's proceed.
Back to, I think I already see very interesting conversations in the chat. I will just look forward to some of them. Thank you.
Okay. Trevor, you've said we've had HIV for more than 4 decades. And all along, you people have been telling us to test. Why is HIV testing still critical among young people today?
Yes. HIV testing is very critical because without testing, you cannot know if you have the virus or not, unfortunately. You cannot test with your eyes and say, Mr. Selfcare is negative or is positive. You never know that either
Trevor,
he has it.
Trevor, our eyes have microscopes. You see, you
No,
judge and make a decision.
actually, and that is why young people are misjudging because you see
Mm,
the curvy ones and then you think that they are okay, yet unfortunately you might land on a. So for us, what we are saying is it is very important for young people to practice HIV testing because that is the only way you keep updated about your health status. Can you hear me? I seem to
yes,
be
please.
freezing.
No, I can hear you.
Yes.
Mm,
Yes. So that is the only way you get to know about your status. So I'll just let people know that every time you have unprotected sex, your HIV status expires. Every time you
mm.
have unprotected sex, your HIV status expires. Simple. So you need to ensure that you keep testing, that you keep, uh, 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 getting to know about. But then also it is important for us to encourage young men to test because for me, Mr. Self-Care, the problem that we have is that men are still a challenge, and for them,
Exactly.
the poor health seeking behavior is extremely high. And that is why we are also very intentional now about reaching men and
Mm,
reaching young men. Because when you have a couple, usually it is the woman that will do the testing, but the man will wait to first get bedridden before he will come. He will tell you he has to go to the garage, he has to ride the motorcycle, so he does not have the time to come and do the testing. So our approach now is, can we carry the services to where they are? Can
mm.
we go to where these men are so that at the end of the day, they do not have an excuse not to seek services? Thank you.
On that point, Trevor, I want to add on. I'm a soccer lover. I love football so much. And I'm here to speak about to my fellow people involved in the sport, the young people in soccer. Please, let's go to test. Let's go and test. Professional footballers in Uganda, the amateurs at all levels, please. The rates of HIV among us footballers is worsening. A lot of young people, especially girls, want to come and happen with us, want to have meaningful relationship with us. And because of that opportunity of having so many girls actually want to be with us, it is actually risking our behavior. It is putting us at a higher risk. I'm here to encourage everyone involved in the game of soccer, football, listening and watching in right now. We love you, we appreciate your talent, but if you don't go to test, if you don't protect the status that you have, you may soon get HIV and that may cut short your talent. I know so many stories of talented people whose talent has been cut by just a simple mistake. But you can't protect a status you don't know. You cannot protect a status you don't know. So the first role or your number one responsibility as a talented or as someone that want to have a bigger future or to play on the highest stages in football is go and test. Locate AHF Uganda Cares and go and test. Or any other testing center that is testing HIV, go and test, know your HIV status, then we proceed. Trevor, we have sisters that are that are we can say at a higher risk, either by what they do or something. Can you give us in a minute something? How effective is PrEP for these young people?
Yeah, so prep is effective. It is effective when used well. So our
Mm,
emphasis is please use it well so that
mm,
the effectiveness is very key. But for us, I think for us, why we push for condom use more
mm,
is because at the end of the day, when you're taking prep, you are not protected against STIs,
yeah,
unfortunately, and you
yeah.
are also still likely to get pregnant, which is an unplanned pregnancy. It is
Mm,
very okay to take the PrEP and it is very recommended. But why we
mm,
push for the condom use in this instance is
mm,
because it offers you the triple protection.
mm,
And the triple protection is where we have the prevention against HIV, STIs, and then the unplanned pregnancies. But it is still very okay
mm.
to take it. And we encourage that the adherence is very good.
Okay.
Yeah.
Trevor, I know working with young people, there are some myths you've come across. What are some of the myths that young people have told you about HIV that you feel are common in the different countries where you've traveled to?
I don't know if this is a myth, but if it is just an attitude that young people have, especially girls, but the thing that we fear pregnancy more than HIV is extremely high. I don't know where to categorize that, whether it is a myth or it is just an attitude, but people will tell you, I fear pregnancy more than HIV. And
Mm,
that is very unfortunate because
mm,
HIV is irreversible. You will
mm,
not get HIV and it cures like a flu for now. It,
mm,
it is something that is going to stay with you.
mm,
But of course, we have a lot of myths that young people have. Maybe when you shower after sex, you will not get the virus. When you urinate, there are a lot of things. Some of them are very nasty. I don't want to mention here. But at the end of the day, what we are saying is, can we access the right information? It is imperative that as young people, we stick to correct sources of information. And even right now, we're also speaking to culture and ensure that even culture is very adaptive to very accurate information so that we are all flowing in alignment. Okay, so it is important that every faction, because someone will tell you, for me, my singer told me this, and I believe in my singer very much. And that's why we're ensuring that everyone has access to the right information, whether it's a religious leader, a cultural leader, parents, community leaders, among others, so that there is harmonized, correct, and accurate information when it comes to HIV. Thank you.
Actually, that is very important. Last week, I was with one of your team members on TikTok Live, and some young man told us that they told them if you do sex and you do it very fast, like like a goat, very very fast, and you get out, you'll never get HIV. And then another person told us Coca-Cola, that they told girls if you immediately after sex you wash your V parts with Coca-Cola yourself. Then another person told them if you're wet you cannot catch HIV. So more girls are taking anything they tell them can make them more wet to make sure they don't get HIV. But to everyone watching, those are all myth, and actually it's one reason why actually so many young people are getting
Yeah.
HIV. Again, we are going to be getting into the comment section in a short in a short spell from now. Trevor, let's talk about behavior. It is sometimes very dangerous to transform societies and areas without addressing the behavior. What are some of risky behavior that has predisposed young people to HIV infection? Maybe that are even responsible for the increasing numbers that we keep seeing every year.
Thank you very much. That's an important conversation. And you see, we've had the head of state say many times that HIV is a behavioral disease. And I
Mm,
really agree in ways, because you see, at the end of the day, um, we need to tame ourselves and ensure that we are having informed uh, sexual behaviors when it comes to HIV. And one of the healthy behavioral approaches we are pushing for is practicing protected sex. It is very important that people just understand that if you are having this partner, you're not aligned for marriage yet, you are 16, 17, 18, you're experimenting, it is important that you practice safe. And we're not saying that those who are not, that we're not encouraging anyone. Actually, at the end of the day, abstinence is still a very crucial message that we share, because and that is where you see the religion and the culture being very critical, because their pursuance of the message of on abstinence is still very critical, because much as all these alternatives are there, we still want people to just, for your own personal, you may want to abstain. So abstinence is still definitely a message, but we also know at the end of the day that not so many people are abstaining, and that is why we come up with a different behavior, with a different biomedical approaches. But definitely, why we push for better behavioral practices and the approaches AHF has under behavioral. One is the peer educators. That's why we're saying that we have them situated in specific strategic communities, so that accurate information is pumped. For example, in Katanga, Kamocha, in Soroti, Fort Portal, etc. We're ensuring that there are peer educators there to inject right information as frequently as they can. We also do radio talk shows. That is very important. Radio talk shows are again another powerful way of reaching people on a large scale. We're also having behavioral dialogues where you sit down different factions of community to sit them down in a discussion on HIV. We've had discussions with religious leaders, with cultural leaders. So all these are strategies to attack or address those high risk behaviors and ensure that we align. Much as we're talking about condom use, we're also preaching protected sex. So we want to align everyone on healthy and informed behavioral practices. And I think at the end of the day, also, that is why we push for sexuality education. Comprehensive sexuality education, or sexuality education as we call it in Uganda, is very critical, because then it empowers young people with accurate information on their sexual autonomy, on their bodies, on their respect, and etc. So at the end of the day, this information is very important to empower young people, be healthy and informed, and make a very important decisions on their sexuality that are accurate and based on fact, to protect them from things like HIV and among others.
Um, Trevor, why do we still have low testing amongst young people, despite increasing testing centers like all over the country?
Why we are still seeing, it is now broken down into different areas, but where we are, we've seen increased uptake, and one of the things is stigma and discrimination, like I said
Okay.
earlier.
Mhm.
Young people just are afraid to be associated with some centers, and
Mhm.
so they are not going there, and that is why outreaches, all these approaches come into play.
Mhm.
We are also seeing an issue of access. Some of these centers are just far away from the
Mhm.
young people. So access is definitely a challenge, and that is why you see AHF intentional on pushing to different communities and reaching different areas to ensure access is increased and people are able to access these services without excuses. Yes, and then also
Mhm.
we are just seeing the lack of information also as well, the lack of information. Then poor health seeking behavior among men that needs to radically change, because young men or men in general are waiting to get critically ill, terminally ill, before they can walk in to a health center. So
Mhm.
these are the different barriers that we have, but like I said, we are trying to address them gradually,
Mhm.
and I believe we shall get there.
Okay. As we conclude this, Trevor, how do you think parents, schools, and the community can better support young people in HIV prevention?
So I want to begin with parents and say that very critical custodians when it comes to young people. A family is one single unit that is responsible for raising the child. So it is important that parents begin the practice of sharing important information on sexuality and sexual health with young people, with their children, with maybe the extended family that they have. At the end of the day, we've seen that because children respect their parents, we've seen patterns of behavior change and raising up well nurtured and better citizens for the country. But then we also see that the schools also have a very fundamental role to play, because we've seen that there are so many things that children are telling teachers that they're not telling parents. So at the end of the day, we're also telling schools not to sugarcoat some of this messaging, but have, of course, age appropriate. Age appropriate is very important,
Yeah.
but our message is, can we have these discussions and not just go over it like it is a topic that you want students to pass in an exam, but something that you would like to be cultivated and well imparted in the students. So let us ensure that we pass these messages. When it comes to religious leaders, it is a contentious discussion, and I believe that we are making progress in areas, but at the end of the day, there are agreeable areas in messaging when it comes to HIV that we are encouraging religious leaders to push for. At the end of the sermon, or you can organize a workshop, a simple seminar, where health is part of the discussions. We are seeing you organizing marriage seminars. How can we also integrate health into those discussions? We are seeing single seminars. Now we're just passed from Valentine's. Almost every church had a seminar. Why don't we use those sessions to push for this message and ensure we transform behavioral change? So at the end of the day, every stakeholder has an important role to play. Mr. Selfcare is here making this information accessible. AHF has opened up its centers and is giving these services. Let the other stakeholders also have a role that we are all playing, so that at the end of the day, ending HIV or ending AIDS is a multi-sectoral role, and we have multi-sectoral wins in this fight.
Trevor, I know you're a person that is deeply rooted in policies. Do you think we have adequate policies in place to make the vision of 2030 possible when it comes to HIV prevention? And if no, what do you think where do we think we need to up? If yes, what do you think? Where do you think we've done well with policies? In a nutshell.
A country, nationally as a country, I would say that we are good at coming up and thinking about the policy. And the policy is very important because it gives direction for how things should go. Like we have the anti-stigma and discrimination guidelines, like we have the HIV Prevention and Control Act that is supposed to guide these principles on testing, etc. But at the end of the day, like many policies outside just health, we are seeing violations. And also, the cause of these violations is because the citizens themselves are not as informed about these policies. And I think that is where I'm stressing that it is important for us to ensure that the general population has information on these policies, because then you are empowered to advocate for your rights, you know your principles, you know your rights as a person. So then, because we have the anti-stigma and discrimination guidelines, we should not be seeing stigma. We should not be seeing people denied jobs because they are living with HIV.
Yes.
We have facts that validate people living with HIV to have jobs of almost every standard, except
Yes.
maybe very vigorous something or one or the other. So it is important, one, for us to empower the general population to understand these policies, and then also to hold these stakeholders accountable. We have policies that have stayed for over 10 years and they've not been, how do you call it, reviewed. We've not seen policy reviews. So it is important that also for the people who understand policies, we get back to the drawing board and say, is this policy still relevant to the current needs that the population has? It is important that policy also keeps alive and, in tandem or very well aligned to the current needs that people have, so that we are able to keep the policy working and functional. Yes.
Wow, that is very important. And as in we are coming to the very end of our presentation, I'm going to be going to the question, but simply before, Trevor, you've traveled around the world so many times. What is the most interesting place you visited on your, I mean, on this work trip of yours, and what made it so memorable for you? Just
Um,
to inspire some young people there that are planning to, to travel the world.
there's interesting in terms of physical beauty, but then there's also interesting in terms of what countries are doing in this response,
Yeah,
because
what countries are doing.
oftentimes it is we go there for learning purposes, exchange
Mm,
visits. For me, I would like to appreciate and give applause to Botswana.
mm,
Botswana is not a very known country, but
mm,
Botswana is doing a lot of amazing work in
mm,
Africa. And when you look at the HIV response, when you look at the 95, 95, 95 targets, Botswana has hit all of them. They have hit
wow.
all of them. And so, but we are looking at also why Botswana has done that. One,
Yes.
we are seeing a lot of government will. We are seeing
Mm,
the interest of the government, Ministry of Health, different partners to invest very heavily in HIV. We're also seeing that their budgets and spending on
mm,
HIV is remarkably higher. So we are seeing that resources have a very critical role to play in
mm,
regards to how an HIV response of a country performs. The more
mm,
investment, the better the results. So we are seeing that. But then at the end of the day, we are also seeing collective responsibility. We are seeing the locals themselves
mm,
taking charge and ensuring that no, we have to use condoms. All the sex
mm,
workers are accessing condoms. Every brothel has condoms.
mm,
People are testing. Services are in each and every corner. Maybe the advantage they have is that it is a small country, but
mm,
then not every small country is doing well. So there is something about their strategy. So when you put all these into play, they are
mm,
teaching countries like Uganda. Uganda was one of the leading countries way back with the Presidential Fast Track Initiative.
mm,
The HIV arm is under the office of the president. So we are
mm,
seeing that Uganda was one of the leading countries when it comes to the response. But we saw maybe along the way priorities kept changing and we lost here and there. So
mm.
it's a time now for us also to return to the drawing board and accelerate progress. And I still believe that we can do this.
Wow. That is so good. And let's go through in a minute or two these questions. Let me start with this one saying, Trevor, can you explain how menstrual health intersect with HIV?
Yes, I saw that question and I think I want to appreciate the person who asked it. They are paying very good attention.
Mm,
So, menstrual health, we usually like to look at it in terms of what we call period poverty.
mm,
Period poverty is a state where the adolescent girls and young women in particular communities are not able to access menstrual health products and they are having challenges because their menstrual health is compromised either due to lack of access to the products or just due to lack of access to knowledge and information.
mm,
So, one very important way that menstrual health intersects with HIV is that when adolescent girls and young women lack access to buy, they do not have money to buy these products, they are oftentimes pushed to what we call transactional sex because
yeah.
they are looking for money to
Mm,
buy these products. So
mm,
oftentimes that transactional sex is oftentimes power, it has power dynamics
mm,
because you are going to this sugar daddy and maybe you're going for survival, you're going for this money. You may not have the negotiation power to ask for the condoms because
mm,
he's the lord at the end of the day. So you'll find that because of that, you exposing yourself to HIV risk by sleeping with this person, and
mm,
you get infected at the end of the day. And most of these are either married men or divorced, something like that. you
mm,
know. And then another important thing for us to note is that because of period poverty or because of poor menstrual health, we're
mm,
seeing that many adolescent girls and young women drop out of school or
mm,
miss out on school. So you're seeing that they're not in class for those days when they're having these challenges. or some of them completely drop out. Now, when they completely drop out, they are now very vulnerable because now they don't have any future, they are very idle. So it is again very possible for someone to, take advantage of them. But also, when you drop out of school, you've cut access to very good information when it comes to menstrual hygiene, etc. So at the end of the day, the risk comes back to this vulnerability to HIV in terms of transactional sex, or being taken advantage of, being married off early because you've dropped out of school. So all these factors come into play.
Yeah. In fact, when I was working with some ministry in the sports, we visited some districts in eastern Uganda, and one of the reasons young girls were giving us for getting married early was lack of menstrual pads. They said I was tired of suffering with menstrual pads, so I decided to get married to make sure I have children, because they told me if I'm pregnant, I cannot have periods. So the reason they go in for marriages at age 13 is simply because to run away from the monthly, they think they're running away from monthly challenges of dealing with periods. Again, this one is asking, what does Trevor mean by youth-friendly services? In a minute, Trevor.
So what we mean by youth friend, that's also very, I appreciate that, Mr. Selfcare, you have a very active audience. So what we mean by youth friendly is non-discriminative. Usually when someone describing to you how they've not been treated well, they will tell you that the Musawa was harsh and they were rudely inquisitive. There is that inquisitive nature that is positive, but then there is this they're criticizing you by asking so many questions. But why you're a very young girl. So what we are saying is about AHF services is that they're going to serve you the way you are, regardless of your priority population or where you belong to, whether it's a key population, a priority population, a young person, etc. So we are very welcoming to every facet of life, especially when it is to do with services. So the services are entirely non-discriminative. So youth friendliness has to do with non-discriminative, but also it has to do with the demure and the mannerism with which someone serves you. If someone is rude to you, even without questioning you, you may not want to come back. Then also, we do not have a lot of long waiting hours. That is another non-youth friendly way. Having very long waiting hours where someone has to just go back home because they've not been able to access the services. I want to encourage you that these services are accessible. You're not going to have that long patient waiting time, but you'll be able to access your services in the time frame that you expect. Yes.
And again, to healthcare workers watching in, when it comes to young people, they don't need to know the PhD that you have, no, but how you smile, how receptive you are to them. Otherwise, the young people don't care if you're a doctor, even if it is a cleaner that is offering them the condom, but is smiling, is willing to explain, you're going to find all of them going to that person rather than to a person having the PhD. So we must make sure we equip ourselves well, knowing that we are going to deal with an age group that is so sensitive to how we serve them rather than how much information we have in our heads. Again, someone is asking, why do people fear pregnancy more than HIV, and what is AHF doing about this?
So, thank you. That is a conversation that is actually to be thrown back to young people. But for
Yes,
someone who has worked with young people,
yes.
I would say that it is maybe because people are not yet. I'll talk about pregnancy. Many young people are not ready to take on the responsibilities of pregnancy or having a child, having a family, nurturing a family. And that is why there is fear for the pregnancy, because pregnancy, the understanding is responsibility. Now you have to live together. Now you have to bring this person into the world. And for many young people, like I mentioned, the unemployment status initially, you will find that many of them don't have jobs. Many of them don't have. So they are afraid of that response, that financial responsibility, or the long-term journey of having an additional person. But at the end of the day, we don't encourage you to hate this child. This is a new life you're bringing into the world, among others. Now, it is dangerous to equate that fear or to rate that fear higher than the fear for something like HIV, because now HIV is very irreversible. What that means now is you're going to be on ARVs for the rest of your life, at least for now, because now you do not yet have a cure, but you're going to be on medication for the rest of your life. So the damage is more, or the impact is higher, because now it is irreversible. It is something that you're going to carry with for the rest of your life. So it is important that young people think about all these risks. Use the condom. It is going to protect you from both. It's going to protect you from HIV, and it is going to protect you from the pregnancy and then the STI. But however, we need to dismantle the mindset that pregnancy is worse than HIV. Thank
Yeah.
you.
Lastly, from Anita. Thanks, Richard and Trevor, for this educative topic. So, concerning on prevention in teens, how do you encourage younger ones on abstaining methods, most so in adolescents?
Actually, for adolescents, I want to first start by letting the adolescents know that there are other biological risks associated with early sexual debut. Early sexual debut is where you have sex at a very young age, or I mean, early sexual debut is, when you have sex at a very young age, So we are discouraging a long conversation where I would indulge in that, but it is important that you take note that you end up damaging things like your cervix when you're having sex very early, and it is very risky and harmful. So we are encouraging young people, especially adolescents, to practice abstinence. And you need to just be in a good place to practice abstinence. Listen to your parents, go to school, have plans for a better future. Oftentimes, the boy you are having sex with at that young age is just a boy that you're not really having love and a relationship that is for furtherance, but just exploring and trying to play that adventure. So it is important that you resist that and wait for the right time to have sex.
Wow. Thank you so much, Trevor. I think, okay. Oh, this one, lastly, is on say, I stay in Luzira. Where can I find Uganda cranes? They meant to say, where can I find Uganda cares in Luzira, around Luzira?
So I don't know which one is so near. I think Uganda Cares is in Naguru. We have a
Okay.
branch in Naguru. That is under China Uganda Friendship Hospital, Naguru. I think that is nearer for you who is in Luzira.
Yes.
Yes. We also have a branch at St. Wali Kudembe.
Mm.
That is in town, and then we have another one along Kira Road. So you can just walk. I think for you can walk straight to China Uganda Friendship Hospital, Naguru. That is the
Yeah.
nearest place for you, and you can be able to access services free of charge. Please do not expect to spend money when you go to AHF. All our services are free of charge, so just come ready to have a good health experience.
Trevor, you could have made a good lawyer by looking at you. And you could also have made a very good news anchor because of your appearance, your smile, and everything. Trevor,
Thank
what
you.
inspired you to personally work with the youth in HIV prevention as we conclude this?
What inspired me mainly is ensuring that we give young people a voice as well. Because you see, oftentimes older stakeholders want to speak for young people, but at the end of the day, we want to show them that they are also empowered young people who can represent other young people. And I think that is why Trevor and other youth advocates are there to fill in the gap and ensure that we represent people who are not able to be in those seats, but speak to the seats of power and ensure that we are representing whoever is not there. But at the end of the day, working with young people is a very rewarding experience as well, because I can tell you young people are so knowledgeable. we underrate or underestimate the amount of knowledge that young people have. But when you sit down and have a conversation with them, you can design something that is very powerful and immense. So I want to urge stakeholders out there to ensure that we have young people's voices included and taken note of in critical decisions that we are making. Let's not plan for young people, let's have them in the room and ensure that young people are able to contribute to the discussions, especially when programs about them. Only then will you have more ownership of the programs by these young people, but also better implementation, and then you'll be able to access them wherever they are because these are led by young people, for young people, and by young people. Thank you.
Trevor, if a young person, lastly, as your last question, asks you for 3 steps to protect their lives, what would you say to them?
3 steps.
Mm,
Yes, one is abstain. That's
okay.
important.
Yes.
Abstinence is still a very important still a very important discussion.
Mm,
And then secondly, if you have a partner, please be
mm,
faithful to them.
yeah.
Being faithful to your partner is very important. If you're already
Mm,
having a partner in your life,
mm.
please ensure that you don't have this playing around. These buddies, young men, these buddies here, they're going to drain your money and they're going to leave you with infections. I
The
must
best
assure.
is,
These besties, some of you have given Valentine's gifts to 5 women. That is dangerous because at the end
Tre-
of the day,
Trevor, actually, at that point, sorry
at
to
the end
cut you short, I
of
have
the
friends of mine who
let's say
work with,
this.
I have friends of mine who work with flowers. Now, I was having a discussion with actually 4 of them, and they told me that one funny thing about Valentine gift is one told me they have not served a man who gave flowers to one person. And one has told me that there are people who give up to 13 flowers on that day. But also the reverse is true, that girls are receiving flowers from more than 3 people going onwards. Actually, this makes this conversation very important. Trevor, what's the
Important,
third point
yes.
you give this young person?
So before we go to the third point, young men, that is pressure and it is not going to take you anywhere. Having
Mm,
those multiple relationships is stressful in every way, financially,
mm,
sexually, and then also your mental state. You're not able to concentrate. But then
mm,
lastly, please use condoms or practice
yeah.
prevention. Right now,
Mm,
we've gone beyond condoms now to encourage you to practice prevention, though we
mm,
emphasize the condom more. At the end of
mm,
the day, if you adhere to those 3 techniques,
mm.
then we can guarantee you to an extent that you're going to have a healthy life. But thank you for joining. I think another bonus point is always listen to Mr. Self-Care because a lot of
Yes.
this is very good information that is coming to your screen just at the comfort of your house or your home.
Thank you so much, Trevor. We are so glad here to have you. And please, before you go, can you send your regards to your family, to everyone at AHF Uganda Care as we wrap up this?
I want to appreciate AHF Uganda Cares for pursuing this partnership and ensuring
Yeah,
that this partnership came to life. I
yeah.
believe that these two serious bodies are bringing this message to you. I want to appreciate Mr. Self-Care with this very important program and for the
Mm,
consistency in having this message coming in every week.
mm.
To my family, yes, I want to appreciate them. To my partner, not partners, I also want to just tell you that yeah, it's all well, but also
Mm.
to appreciate everyone who has been part of this very important discussion. Please share this message, don't keep it to yourself, share this message around, ensure that as many people get access to this information so that we are able to fire down or burn down that misinformation that is out there on the internet that is trying to distract this important messaging. At the end of the day, all this is very important in ensuring that we increase information and awareness and end AIDS among young people. Thank you for having me.
Thank you so much to everyone that watched in today, and to AHF Uganda Cares for making this partnership possible, and for loving Ugandans and accepting to offer us your support, your staff every Wednesday night to make sure that Ugandans learn. To everyone that is that doesn't think this is a very important topic, I want to give you a hint. In the current Olympics, the organizers supplied more than 1 million condoms. And if you're reading around, they were done in 2 nights. It shows how the rest of the world is actually putting importance to HIV prevention. Now we are talking about athletes. People we think are very busy, even don't have time to practice. That's how much they use the condoms. Now to the young person watching in right now, that condom could be the difference between you being HIV negative today and HIV positive tomorrow. To the parents watching in, the worst thing is for us to think that in our bedrooms, in our houses, we are having little Jesus or little Muhammads that are so holy and whatever. These young people are doing things. The more we keep quiet about this, the more we are actually sacrificing them. As we wrap up today's conversation, the message is very clear from Trevor, me, and everyone that has bothered to read around the HIV trend. Ending HIV is very possible, but it requires youth leadership, prevention, and clear action. To the people in authority, our leaders, the different governments watching right now, the young people are not stupid, the young people are not deaf, the young people are not insane. These are people who are very active with a sound mind, very knowledgeable, that actually can take charge of their things if empowered. Let's give them platforms. Let's stop the habit of using people that know nothing about being young anymore, trying to advocate, trying to speak for the young people.
Yeah.
The young people can actually speak for themselves. Let's just make the platform leveled for them to come and speak for themselves. Let's move from awareness to action. We've signed a lot of memorandums. We've launched so many projects. Let's move to actions. To funders and donors out there, let's fund initiatives like AHF Uganda Cares to make sure this message is taken closer to areas where young people are living and staying. Last week we had the condom commemoration in Fort Portal, and I believe lots of condoms were shared just before Valentine's Day. And you just don't know how many people AHF Uganda Cares saved by just giving them free condoms on that day. Me and you know that young people are still scared of walking and picking condoms from the places where they are sold or being kept. So initiative of taking them the condoms to where they are staying can actually help thousands from contradicting HIV and other sexually transmitted infection. Imagine this drive was possible to happen to all the districts in Uganda on that day of commemoration. Imagine there were funds for AHF Uganda Cares to have this celebration in more than 10 points at the same time. You just don't know how many lives we would have saved. Again, a big thank you to you, Mr. Trevor from AHF, for sharing your invaluable insights on the topic. Please, to young people watching, don't forget to subscribe, to leave your comments or your question in the comment section, whichever time you're going to watch this. We believe this is valuable information. And again, to continue this discussion, I want to remind you on Friday at 9:30 p.m. we are going to continue this conversation on TikTok. Just look for spaces of Mr.Selfcare on all social media. We are going to have a conversation on TikTok with another person, or even Trevor if he's available, to continue this discussion. We want to talk to as many young people as possible. But also on the X platform, the X Twitter page, we are going to have a conversation still the same. We want to continue this message until we touch as many lives as possible. To everyone in our production, on my production team, and to my supervisor and everyone that is watching, and thank you so much for being part of this. We wish you a very good night or good morning, wherever you're watching this from. And we pray that more young people get this information. Please share this with young people. It is sensitively made. We've made sure we use the right terms that they understand and words to make sure it is a rightful package for them and to make it user or youth friendly. Thank you so much again from me and Mr. Trevor. We wish you a good night and may God bless you.
Bye.
Enjoy and bye.
Bye.
Mhm.